Hi there, Dave, Wellness and Health Promotion Manager at DCare, and today I want to talk to you a little bit about well-being and our oral health in relation to Covid-19. So I suppose the first thing to begin with, just the mouth. Our mouth is the gateway to the body. I mean, we use it for eating, speaking, appearance. It's linked to mental health, self-esteem, and it really is the entry point to our body, the gateway. And we know with Covid-19 that the nose and the mouth are entry points for the virus to enter. So I suppose it goes without saying that following the WHO's hand washing technique, that we need to be washing our hands stops the spread of the virus. So just to be a little bit mindful that we should be washing our hands before we brush our teeth and after we brush our teeth also, particularly with flossing as well. What I'd say to you is, it goes without saying that we should never share a toothbrush, but also with our families, and if some people are working in the front line in retail services, and they're exposed to people on a daily basis, they're coming home to a family environment, it's really important that we keep our social distancing, that we're not all using the one bathroom at the same time with kids and different things. I'd also say to you with toothpaste, and particularly we should be using a toothpaste fluoride, about 1450 parts per million, that we're not all kind of using the same kind of tip, that we kind of have a clean plate, that we pop a pea-sized amount onto a plate, and it's a great way for kids and for adults, so we're not cross-contaminating the toothpaste during this time. Also with flossing, what I'd like to say to you is, when we floss our teeth, again our mouth hosts close to 200 different types of bacteria. It is a gateway for the virus to enter. We have to remember as well, people are asymptomatic with Covid-19. So with flossing in particular, if we're flicking, onto the mirror, onto the surrounding areas, that we need to be sure that we're hand washing afterwards, but also that we're cleaning that whole area down. I'd also like to say, if we're looking for checking in on a loved one, an elderly, someone who wears a denture or partial denture, or an elderly neighbour or family member, and they have any trouble with dentures, particularly during this lockdown time where, our dental services are open for emergencies, we can contact the dentist, but in between, if there's a chip or a fracture on a denture, we can actually use an emery board to kind of file that down and make it more comfortable for the person. So it's just getting a little bit practical at this time if the situation kind of arises. I'd also say, just because we're out of routine and we're creatures of habit, that we kind of, be mindful of sugars. We're looking for kind of things that are intrinsic sugars, naturally present in things like fruits, vegetables. Fill our diets with that because, it has fibre in it and it doesn't lead to a lot of adult chronic conditions. Whereas extrinsic sugars, which are added to processed foods that have long shelf lives, high in salt, high in sugar, cause these adult chronic conditions and also dental decay. So it's really important to look after our well-being from that aspect. What I'd say to you is, if someone gets sick or has Covid-19, it's really important that we change your toothbrush, and that's can be, we got at supermarkets and chemists. Also with electric toothbrushes, some family share different heads. Make sure where we're storing these, we're washing the containers, and also that it's not really suitable to be changing heads at this time. Use its toothbrush, and if we do get sick or get flu-like symptoms, and particularly if people are asymptomatic, that we're throwing that away as well. What I would say to you is, we've never been through this. It's a challenging, unprecedented time, but we will get through it together. We will get through these times. So thank you for listening to me today.